Imagine every major highway narrowed and clogged with debris, slowing traffic eventually until it comes to a complete halt. Well, this is the same thing that happens with the heart with coronary artery disease, a condition in which arteries that carry oxygen-rich blood to the heart becomes narrowed and clogged with fatty deposits called plaque. Hey everybody, this is Chantel back with another educational video, and today I'm going to be talking about coronary artery disease. So what is coronary artery disease? Well, it is a very common heart disease that slowly progresses when the fatty plaque, which is also called atherosclerosis, begins to slow down the perfusion of the blood to the heart. And most people who have coronary artery disease will have symptoms like chest pain, shortness of breath, swelling in their lower extremities. They may have dark colored lips because they're not getting enough oxygen throughout their body. And they may also have heart palpitation, abnormal EKGs as well. Generally, risk factors for that would be obesity, smoking, stress, high blood pressure. Of course, our diet as well can play a major factor in that as well. Those who are at risk of CAD are African Americans, men who generally get it early on in age. Women also can get it usually after menopause, and those who smoke cigarettes and have really high fatty diets as well. Because fatty plaque deposits consist of lipids, cholesterols, and calcium, we can do blood tests to check to see those levels. So most physicians will order either a cardiac panel or a lipid panel. And so that's going to look at the patient's good and bad lipids. So HDLs, which are your good lipids, I always think happy when I think of HDLs, and then your LDLs are your bad lipids. So I always think loser for those. And then we also can check, like I said, the cholesterol and the calcium as well. In phlebotomy, we will be drawing a SST for that test. Those who do have really bad lipids and cholesterol levels, it will show up in their blood. So as you can see here, this tube has the serum on it is actually like a milky color, which we call either litmic or turbid in appearance. And that's because this patient has a very high fatty diet. And again, whatever you eat is going to show up in your blood work. For my EKG technicians, a stress test can also be ordered as well to check to see the health of the person's heart. If a person does not do well on their stress test, that could be a sign of some type of heart disease as well. So, what can you do to help prevent coronary artery disease? Or if you already have it, what can you do to prevent it from progressing even further? Well, first off, your diet. Diets in low fat, low sodium will help. Exercising will help, at least 20 to 30 minutes every day of some good cardio. And stress, preventing stress as much as you can. Also, not smoking and drinking alcohol as well will help. Coronary artery disease remains one of the most significant causes for morbidity and mortality worldwide. As a matter of fact, heart disease is the leading cause of death here in the United States. However, knowing about the pathophysiology, the clinical manifestation, and the risk factors of CAD will help prevent and lessen those effects of CAD. If you want more information about coronary artery disease, you can go into the American College of Cardiology or the American Heart Association. And as always, like, subscribe, and follow us for more information.